Welcome to OET Answers.
You can start your speaking role play. Don't worry if I stop you when the time is up.
Good morning. I'm Naso Andrew, one of the nurses here. Could you please confirm your name for our records?
Yes. My name is Patricia.
Patricia, I see you have an appointment today. Can you confirm the reason for your visit?
I'm here to get information about my mother, Patricia Portsmouth's post-discharge care. She recently had a cholecystectomy and is now being discharged.
Thank you for the information. Before we proceed, could you tell me about the arrangements you've made for your mother's living situation after discharge?
We've made arrangements at home. The house has been disinfected, and her room has been modified to meet her needs.
That's an excellent decision. Being at home is special, and it's great to hear that you've made the necessary modifications for her.
I thought it was important to make sure she's comfortable when she returns home.
Absolutely, Patricia. Creating a safe and comfortable environment at home is crucial for her recovery. By the way, having her stay with family not only provides practical support but also emotional comfort, which plays a significant role in her healing process.
Yes, I want her to feel supported and loved, especially during this time.
That's wonderful to hear. How has your mother been feeling since the surgery?
She's been doing well, actually. She seems much better than I expected. The hospital staff has been great.
I'm glad to hear that. Your satisfaction is important to us. The concern you have about her discharge is completely understandable, especially considering her age and the surgery she's had. The extended stay was necessary to monitor her recovery closely and ensure there were no complications.
I appreciate that. I just want to make sure I'm doing everything right when she gets home.
And you're doing a great job already, Patricia. Let's talk about the wound care first. It's crucial to clean the wound daily, and we'll demonstrate the process to you before she leaves. You'll need to keep the wound site covered to promote healing and prevent any potential infections.
I can handle that. I'll make sure it's done properly every day.
Excellent. Just remember, your mother has dissolvable stitches, so there's no need for a follow-up visit just to remove them. They should dissolve on their own within 2 to 3 weeks.
That's reassuring. I was worried we'd have to come back to the hospital for that.
You're right to ask, but no additional visit is needed for the stitches. Now, let's go over her medications. She needs to continue her oral antibiotics for 5 more days to prevent infection. Pain relief medication should be given only as needed. Additionally, she's been prescribed laxatives twice daily, but only if her stool becomes loose, you can reduce or stop it.
Got it. Antibiotics for 5 days, pain relief as needed, and laxatives unless her stool is loose.
Exactly, Patricia. You're on top of things. It's important to stick to these instructions to avoid any setbacks in her recovery. Now, let's discuss a few restrictions your mother must follow.
What kind of restrictions?
First and foremost, she should avoid lifting anything heavy, as it could strain her surgical site and cause complications. Gentle exercises like short walks are okay, but nothing too strenuous for the next several days.
I'll make sure she doesn't do anything that could put her at risk.
Perfect. And regarding her diet, it's essential that she eats small, frequent meals to maintain her nutritional status. It's better for her digestion and will help her regain her strength.
I'll prepare meals that are easy on her stomach and make sure she eats regularly.
That's exactly what she needs. It's a lot to manage, but you're handling everything wonderfully. Just remember, we'll provide all this information in a discharge pack so you can refer to it anytime.
That's really helpful. I was a bit worried I might forget something important.
Don't worry, Patricia. We're here to support you every step of the way. The discharge pack will include all the details we discussed, plus some extra tips for her recovery. And you can always reach out to the medical team if you have any questions or concerns after discharge.
I feel much better knowing that.
I'm glad to hear that. Also, let me outline the additional support available for your mother's care. The nearby community health center can provide essential care during her recovery. The community nurses like myself will be available for home visits if needed. And her doctor will be on hand to assist with any medical concerns.
That's good to know. It makes me feel less overwhelmed.
You're doing an amazing job, Patricia. It's normal to feel a bit overwhelmed, but with the support system in place, you won't be alone in this. Is there anything else you're unsure about?
No, I think you've covered everything. I feel well informed now.
That's what we aim for. Always feel free to contact us with any questions, no matter how small they might seem. Your mother's well-being is our priority, and we're here to help you both.
Thank you so much, Nurse Narso Andrew. I really appreciate your help.
You're very welcome, Patricia. I wish your mother a speedy and smooth recovery. Don't hesitate to reach out if you need anything at all.
I will. Thank you again. That is the end of your speaking role play. All the best.
Thank you.
Thank you for watching. Please like and subscribe for more videos like this. Kindly comment your suggestions and help us to do better.